Hi, I'm Dr. Sian Cole, Senior Health Psychologist, and this video is about meeting your treating team. As you are aware, being an inpatient, you realise that a whole team of people are looking after you. And actually, multiple teams are likely to be looking after you. This video is going to introduce you to the doctors, nurses, and multidisciplinary teams that are involved in your treatment. It's easy to get lost in all the names and roles and disciplines that are involved in your care. So I'm hoping this video might help with some of that. Firstly, I'll talk to you a little bit about the doctors. So you're probably aware that you meet a variety of doctors while you're an inpatient. And this slide is actually about the hierarchy of the doctors. I'm not discussing the different specialties of medicine, such as nephrology, dermatology, oncology, so on. This is more about understanding the different roles of the doctors. So the consultant, that's normally the doctor that you're admitted under, and their name might be on your bed board. And they're the senior doctors, and they tend to be seen when they're doing their daily or maybe bi-weekly ward rounds. The level just below consultant is the registrar. So they will be the senior doctor mostly on the wards, and they're supervising the residents and the interns and the medical students. The resident is probably the one that you might see throughout the day, and they're the main doctor that's looking after the patients on the ward. And they are a medical doctor, but they're going through their training for their specialisation, which is why they are supervised by the registrars and the consultants. And then you might come across a few interns as well. And they have also completed their studies, but they're kind of, trying out different specialties. They kind of rotate around the hospital, and it's doctors' ways of learning a whole lot about medicine post their university qualifications and actually practicing medicine. Nurses. Now, nurses are the backbone of the hospital service, as you're very well aware. And there's a whole bunch of different types of nurses that you may meet. So the nurse unit manager, they are the ones who run the ward, really. They are the manager that make sure that nursing shifts are filled, supervises nurses, deals with any issues that kind of pop up on the ward. So they're called NUM for short. So you might hear that word sometimes, and yeah, that stands for nurse unit manager. The nurse in charge, or the NIC, is the nurse who is in charge of that shift. So you've got the 3 shifts. You've got morning shift, afternoon shift, and night shift. So the nurse in charge is whoever's in charge of that shift. And sometimes that nurse in charge is the NUM or the ANUM, the acting nurse unit manager. Clinical nurse consultants, also called clinical nurse specialists, they have extensive and highly specialised knowledge, and they work in a variety of different roles. So they have CU liaison, CNCs, acute pain, CNCs. There's a whole variety of different areas that they work in. So they normally consult into your care. And then more on a daily basis, providing you with the care, administering you medications, helping you have a shower, looking after, your dressings, things like that. that's going to be your registered nurse. So a registered nurse is somebody who has finished their degree and are working on the wards. They may support an enrolled nurse. So an enrolled nurse is somebody who's completed at minimum their diploma in nursing and is still working to or maybe working to become a registered nurse. So they can still do a lot that a registered nurse can do, but they're still having to be overseen for doing things like administering medication. And then you may also come across a student nurse as well. As you're probably aware, we do a lot of training in tertiary hospitals. There's a lot of students, medical students, nurse students, physio students, psychology students. This is their way of learning on the job training along with their university degree training. Allied health is another big part of being in a hospital and part of your team, your treating team. So allied health professionals are health professionals that are not part of the medical, dental or nursing professions, but they do have university qualifications and they specialise in a different number of areas in helping prevent, diagnose and treat a range of conditions. So I'll be introducing you to a few of those in a minute. So often allied health professionals work within a multidisciplinary team and they can work both as inpatient or outpatient settings. I have a little website there of the allied health practitioners website if you want to learn more. Physiotherapy. So physios are experts in the structure of the human body and how it moves. So they work in a variety of different settings, and I will hand it over to my colleague to talk a little bit about what physio does in an acute medical setting.
My name's Eleanor and I'm a physio in a hospital, and I'm going to be telling you a little bit about what I do at work every day. So as a physio, my job is to make sure that you're moving around safely and to get you home. So what that involves is first of all asking you lots of questions about how you normally move around at home, whether anyone helps you at home, what kinds of things you need help with, and how your house is set up, to make sure that we have all the background information that we need. And from there, then we'll do an assessment. So this might include looking at your walking, looking at your strength, your balance, coordination. Sometimes we might look at your breathing and how your lungs are going. After we've done our assessment, we'll work with other members of Allied Health to make sure that we can get you home as safely as possible. So this might include equipment like walking sticks, walking frames or crutches, or carer training for anyone that might be helping you at home. And then we can also organise any follow-up physio if you need it down the track as well.
Occupational therapists help to promote health and well-being with people to participate in their everyday functions. I will hand it over to the occupational therapist to tell a little bit more about what they do in a hospital setting.
Hi, my name's Taya and I'm an occupational therapist, or an OT for short. You may think that OTs are just like physios or that we help people to return to work, but that's not the case. OTs help people following illness or disability return to the things that they love to do or that they need to do. Could be anything from getting themselves dressed or going to the shop or returning to work. OTs work in all sorts of settings, including schools, hospitals, and return to work. I work in a hospital and my job is to help people to return home independently and do the things that they need to do every day.
Speech pathology. So speech pathologists help people with their language skills, reading, writing, talking, but also with their swallowing as well. So I will again also hand over to the speech pathologist to share about what they do in a hospital setting.
Hi, my name's Anna and I'm a speech pathologist. When I tell people what I do, they usually think that speech is just work with kids, treating lisps and stutters and other speech impediments. And you're not wrong, it's actually how I discovered the profession, as I was treated by a speechy for a lisp as a kid. But I actually work in a hospital setting with adults who present with a range of communication, cognitive and swallowing impairments caused by health conditions like stroke, brain injury, progressive neurological disorders like Parkinson's disease and MND, cancer, particularly head and neck cancer, and other chronic health conditions. In short, I help people eat and drink again safely and to communicate or talk again with their loved ones.
Dietetics. So dietitians are experts in food and nutrition, which you can imagine is really important when you're unwell and dealing with illnesses, disability, being unwell in a hospital. Again, I will get my colleague to discuss what it's like to work as a dietitian in a hospital setting.
Hi, my name's Jess. I'm a dietitian. I work on inpatient wards and doing a bit of outpatient work as well. I guess just, one of the things that we do the most is treating and preventing malnutrition. I work on a rehab ward treating a lot of stroke patients, so malnutrition is quite a big issue in that cohort. Also, we do a lot of enteral nutrition, so that's nasogastric tubes and peg tubes. And the work can vary a lot as well, depending on, what kind of cohort you're working with. We work in, a multidisciplinary team with a lot of other allied health. And I guess one of the biggest myths is that dietitians are, watching what everybody eats and putting people on diets, but one of the main things that I do is just trying to get a lot of people to eat more, because malnutrition is a bigger thing than a lot of people think it is in hospitals.
Social work. So social workers help people to improve their personal and social well-being and really link people up to a variety of different services to help people be able to cope at home. Here is my colleague talking about their experience of working as a social worker in an acute hospital setting.
My name's Chummy and I'm an acute hospital social worker. I make sure that my patients are safe and supported once they're ready for discharge. As part of my role, I do several things, including organising services for older patients or patients living with disability, providing emotional and bereavement support, safety planning for victims of family violence, ensuring safety of children at risk, and the list goes on. I conduct psychosocial assessments to provide a holistic perspective to the multidisciplinary team so that the patient receives person-centered treatment.
And health psychology. So I've already made a couple of videos on what is health psychology, or my other video on what it's like to be a medical acute inpatient psychologist. But the main thing is it's really about helping people do what they need to do while they're in hospital. Here's a little video I have made earlier.
As a health psychologist that works in an acute medical hospital, my main goal is to help people to manage their thoughts, feelings, and most importantly, their behaviours in the context of illness, injury, or disability. It can be highly stressful dealing with all sorts of medical issues, and my goal is to help people adhere to their treatment, be it medications, surgeries, or therapies like physiotherapy. I guess one of the most common myths about seeing a psychologist is that you're not coping, or that you've got a mental illness, or that you might be needing an admission to a psychiatric unit. And that is not the case. I treat normal people going through stressful times, and it's about teaching coping strategies to get people through.
There are also more allied health than I've been able to include in this video. So hopefully that might be a video that I do in another day, talking about some of the other allied health professions that work in hospitals. Hope this video helped you understand a little bit more of your treating team. Thanks for watching.